I'm an executive at a staffing firm. I have 3 sons, 2 from a previous marriage, and Jamie and I have a baby, Dylan. I remember waking up and getting on the bike downstairs, and then I remember having a great ride and coming upstairs, and there was a package on the porch, and then I kind of went dark. I couldn't feel the left side of my body, so the door slammed.
I heard a big thump on the front porch, and when I looked on the camera, I saw Andy grabbing something off of the front porch, and it looked odd. And so I was a little snoopy, and I found him in the living room, and he was face down on the couch. I rewound a little bit, and I watched the whole thing play out. Traumatizing.
And the next thing I know, the paramedics were standing over me.
We learned he was having a stroke, and they got him out the door right away.
Got to the emergency room at Evanston, which is only a few minutes away, so that was obviously unbelievably convenient. I remember people standing over me, and I remember feeling okay because everyone was very confident.
When he gets wheeled in, he's seen and evaluated immediately and sent for imaging. That imaging then goes directly to the cloud. Artificial intelligence processes the imaging, interprets it, determines there's a large vessel occlusion, determines there's brain at risk and brain that can be saved. All of that information is sent to me on my cell phone. I'm able to interpret the results of the Viz.AI system, as well as look through the images directly, determine that Andy's a candidate for intervention, and then proceed to intervention right away.
I was a disaster when I arrived to the hospital because I just saw Andy being paralyzed in my head, and I didn't know if that would reverse. Dr. Gill was on like a video robot machine. He told me that Dr. Chowdhury would meet me in the ER waiting room once the procedure was done, and I didn't know what our future looked like.
Then I kind of remember waking up a few hours later and people coming into the room for the next 2 days saying, "You have no idea how lucky you are." I became much more aware of the technology afterwards and realized it saved my life.
Before Viz.AI, we still worked very hard to try and intervene as early as possible. There was a time period in which the imaging had to be obtained and then had to be processed and interpreted. The AI system can interpret it in as little as 12 seconds and often in under a minute. Its accuracy is good and it gets better, so it's learning over time. It's an evolving artificial intelligence platform. It puts them in a format that I can manipulate and interpret them just as well as I could on a PACS machine. So it makes those images immediately available to me in real time. And it gives a platform that we can connect to the other physicians as well using a HIPAA-compliant modality. I don't have to call everyone individually. They can all be connected through the app.
The fact that we're able to do this over the phone is pretty amazing. You never think that cloud-based technology would save your life. I got out 48 hours later, just a miracle on every level. And then a couple of months of OT, PT, speech.
From that point, it was just a road of recovery, pushing him because I wanted him to be his best. I went to the therapy with him and we made a plan of how to get him back to this.
My life was North Shore Connect for 6 months. Communicating with the doctors, getting updated test results, scheduling appointments. Jamie was managing not only our 1-year-old's life, but mine as well.
Well, at North Shore, we take pride in using every bit of additional information, every bit of cutting-edge technology we can to improve patient care and patient outcomes. So in Andy's case, he experienced the interface between the ambulance and the hospital ahead of time, the immediate evaluations with imaging and artificial intelligence processing, video interface with telestroke to have a board-certified neurologist doing the evaluation, and then follow up with North Shore Connect and telemedicine for ease and comfort of maintenance of care for him.
Things are getting back to normal pretty quickly. You're never prepared for anything like this, ever, right? Before and even more importantly after. Talk about it before, like what happens if, not a stroke, but any type of medical emergency.
Having someone have your back and someone stand up for you is really important.